Hello, friends. I am Dr. Barbie Wasson, and this is River Point's podcast where we get to the point on all things acupuncture, health, and vitality in the River Valley. Today, we are talking about neuropathy, a condition I see a lot in practice and one people often live with for far longer than they should. Neuropathy tends to arrive quietly. Little tingling, some numbness, strange burning sensations at night. Over time, it becomes familiar and almost normal until symptoms increase to the point where you have to seek help. And for many people, the diagnosis explains the symptoms but offers very little indirection. Most patients leave appointments knowing the name of the problem, but not the path forward. That uncertainty is what I would like to address today. Neuropathy is not a single condition. It is a broad term used to describe dysfunction of the peripheral nerves, the communication system responsible for sensation, movement, and balance. When nerve signals lose clarity, symptoms appear. Those symptoms look very different from person to person. Some people experience sharp electric pain or burning sensations that worsen at night. Others notice numbness, heaviness, or balance challenges. Many experience a mix of pain and loss of sensation and function. These differences matter because they point to different mechanisms inside the body and require different strategies of care. The causes also vary widely. Diabetes remains one of the most common contributors. Chemotherapy often triggers neuropathy in the hands and feet. Compression injuries, nutrient depletion, autoimmune activity, medication side effects all fall under the same umbrella. The label stays the same even when the root issues differ. So let's talk about conventional medicine and how they like to approach neuropathy. The first priority focuses on identifying contributors. Blood sugar patterns receive attention, medication effects get reviewed, vitamin levels get assessed, structural nerve compression gets ruled out when appropriate. The second focus centers on symptom management, especially pain. Medications like gabapentin, pregabalin, duloxetine, and tricyclic antidepressants reduce pain intensity and improve daily function for many people. These tools help people cope, but they do not repair nerve tissue and they don't come without side effects. The third goal protects quality of life. Physical therapy supports balance and strength. Foot care reduces complication risk, and exercise improves function and symptom burden. This model brings clarity and structure. It helps people stay functional. Yet many patients feel stuck at a plateau. Pain might soften, but numbness stays. Sensation doesn't fully return, and sometimes there's new symptoms with medication side effects. Pain control and nerve restoration are different goals. And Chinese medicine approaches neuropathy from another angle. Instead of asking what damaged the nerve, it asks why the nerve no longer receives what it needs to function well. We look at circulation, nourishment, and nervous system regulation. We ask questions like whether blood is reaching the extremities, whether tissues receive the appropriate nutrients, whether the nervous system stays locked in a chronic stress response, and whether stagnation blocks communication. From this perspective, neuropathy often fits patterns, such as qi and blood deficiency, which shows up as numbness and fatigue. Blood stasis tends to produce sharp or fixed pain. Cold and damp patterns feel achy and heavy and worsen in cold conditions. Hello, Wisconsin winters. Yin deficiency often presents as burning sensations that worsen at night. These patterns guide treatment. They are not boxes or diagnoses. They serve as functional roadmaps that direct how we best treat you as an individual. In essence, your pattern is an instruction manual for me to make sure that the care is unique to you. Acupuncture supports nerve health by improving microcirculation, regulating nervous system signaling, and reducing inflammatory tone. Now, let's talk research, because everyone's favorite question for me is, yeah, but does acupuncture really work? Well, the strongest evidence focuses on diabetic peripheral neuropathy and chemotherapy-induced peripheral neuropathy because these are the two most studied causes. Systematic reviews show acupuncture improves pain, numbness, and overall symptom severity in diabetic neuropathy. Some studies also show improved nerve conduction velocity, which points towards functional support beyond symptom relief. That means your nerves are healing. In chemotherapy-related neuropathy, acupuncture improves sensory symptoms, pain severity, and quality of life when added to the standard of care. Across studies, acupuncture shows a strong safety profile and consistent clinical benefit. This is why integration matters. Conventional medicine excels at identifying causes and managing risk. Chinese medicine excels at restoring circulation and regulating the internal environment. One provides structure, the other supports repair. Together, your outcomes expand. So what does neuropathy care look like in my office? Care begins with me listening. I want to hear about your symptom quality, symptom distribution, the triggers that you're having, maybe some sleep patterns you're struggling with, balance changes, and overall health. Those all go into shaping our plan of care. The goals stay consistent: reduce pain and hypersensitivity, improve circulation, sensation, and function, support nerve recovery by regulating the nervous system and internal terrain. Treatment often includes acupuncture, of course, focused on nerve pathways and circulation, and adjunct therapies such as cupping and gua sha, or herbal medicine when appropriate and preferred by you, the patient. Lifestyle guidance stays practical and realistic. I love using food as medicine, supporting stable blood sugar, gentle movement, and restorative rest. Nerves heal slowly, and progress does require patience, but that patience is met with reward. When the internal environment improves, positive change tends to follow, with overall health and vitality increasing as well. Here is the takeaway I want you to hear. Neuropathy does not mean you are stuck and out of options. People live for years believing symptom control marks the limit. It doesn't. When nerve health receives attention from both structural and restorative angles, outcomes expand beyond pain reduction. Sensation improves, function stabilizes, and confidence in your healing ability returns. If neuropathy has become something you tolerate rather than treat, it may be time for a different approach. You deserve more than symptom management alone. You deserve a plan that looks at your whole nervous system. This work asks for patience, yes, but it also offers real possibility. If you live with tingling, numbness, burning, or balance changes and want a thoughtful, evidence-informed path forward, I invite you to schedule a consultation with me. We'll talk through your history, your options, and whether acupuncture fits into your care plan. You do not have to navigate this alone, and you do not have to settle for feeling stuck. That is it for this week's River Points podcast. Make sure to share this with someone you know who is affected by neuropathy, and give us a follow to keep learning more about the wonderful possibilities of acupuncture and the ancient wisdom of Chinese medicine. With wishes of wellness, I'm Dr. Barbie Wasson, your Chief Circulation and Sensation Restorer.